Hi, I'm Dr. Steve Myers, and I'm here with my patient Barbara, who is 3 months out from a combined regenerative procedure for right knee arthritis using adipose stem cells collected from her adipose fat tissue from her belly region, along with combining PRP injected into bone for bone problems that she had, where she had arthritic issues going on inside the bone. Before we talk to her, we're going to take a quick look at her imaging studies. Okay. So looking at her x-rays, this is a standing x-ray looking at both of her knees. You can see that her right knee has already been replaced. Looking at her left knee, she has some notable joint space loss on the inside of her knee, a couple bone spurs, but not bad looking arthritis. Moving to her MRI, you can see that she has these areas of bright change going on in the bone on both sides of the joint. These areas of bright change are swelling going on inside the bone of the femur and the tibia. And as I scroll through, you can see more intense swelling in the tibia here and again here. And these areas of bright change can be notable generators of pain. And to treat these, it's not enough to just to go into the joint. Treating into the joint with stem cells will not help these bone issues. To treat these bone issues, you have to inject into the bone directly using concentrated platelets from the blood. What that looks like, you can see here the intraosseous bone injection going into the bone to treat the femur and also going into her tibia to get a healing response in the bone. This is a combined procedure using adipose stem cells into the joint to try to regrow cartilage, along with PRP into the bone to treat those bone lesions of bright change going on the MRI to get a more complete healing response in the joint and in the bone. Okay, so take me back to before treatment. What kind of issues were you having with your left knee? Describe the problem.
My knee hurt continuously. Sometimes it was worse when I laid down, and sometimes it wasn't. It was painful. It was really painful.
Were you requiring medication for the pain?
I was taking Tylenol and Advil and things like that just to try to help.
What activities were especially difficult for you before treatment?
I wasn't doing Pilates anymore because it was hurting when I was doing it, and I thought I would injure it more, and that I was scared I would do more to hurt it. It made me reluctant to do certain things.
And so how did you come to the decision of doing regenerative medicine for your knee issue?
Well, I talked to Dr. Myers, and I'd had a scope before on my right knee, and to me the scope was no difference than the knee replacement, and my knee was not ready for a knee replacement, so I wanted something alternatively. I lived with a husband who has dementia, and he could not help much, and I knew, and I've studied this, I'm a librarian, I tend to do research, and I did research on it, and I thought, well, this was an alternative.
Very good. And so here we are 3 months out from procedure. How are you doing?
I'm doing great. I'm never in pain. I'm climbing stairs. I'm doing Pilates. I'm very active for an 80-year-old. I'm just so glad I did it.
So thinking about the knee at this point in time to before you did the treatment, 10%, 50%, 80, 90, 100% better, what would you say?
100%, I would say. I don't realize anything was wrong with it. I mean, that's the difference.
Fantastic. So before I let you go, would you mind demonstrating a couple exercises for me? Okay, so without using your hands, can you get up from the chair?
Yep.
Pain in your left knee?
Nope.
Excellent. And can you step up on this step for me with your left foot first? Good. And come back down. And turn around. How's the pain?
No pain.
Fantastic. Well, thank you so much for sharing your experience.
Thank you.